Discovering the ideal sleep aid can be like finding a needle in a haystack. Temazepam, a popular prescription medication, has gained attention for its effectiveness in promoting sleep. However, like any drug, it comes with its own set of side effects. In this video, we will unveil the side effects of temazepam, shedding light on the potential risks and dangers associated with its use. Our mission is to safeguard your sleep and overall well-being. From drowsiness to dizziness, blurred vision to memory problems, the side effects of temazepam can vary in severity. It is crucial for users to be aware of these potential adverse effects to make informed decisions about their sleep medications. We will explore common side effects and delve into the precautions that can help minimize any potential harm. A good night's sleep is essential for your physical and mental health. Don't let the allure of temazepam's sleep-inducing qualities blind you to the potential risks. Join us as we unravel the temazepam side effects, empowering you to make the best choices for your sleep and overall well-being. Sleep better, live better. What is temazepam? Temazepam belongs to a class of medications known as benzodiazepines, which act as central nervous system depressants. It is primarily prescribed for the short-term treatment of insomnia, helping individuals fall asleep faster and stay asleep throughout the night. Temazepam works by enhancing the effects of a naturally occurring neurotransmitter in the brain called gamma-aminobutyric acid, GABA, which helps to calm the brain and induce sleepiness. Despite its effectiveness in promoting sleep, temazepam is not without its potential side effects. These side effects can vary from person to person and may depend on factors such as dosage and individual sensitivity. It is essential to be aware of these side effects to make an informed decision about using temazepam as a sleep aid. Common side effects of temazepam. Drowsiness. One of the most common side effects of temazepam is drowsiness. It is essential to take this medication only when you have enough time for a full night's sleep, as it may impair your ability to wake up fully alert in the morning. Dizziness. Temazepam can cause dizziness, especially when getting up from a sitting or lying position. To prevent falls or accidents, it is recommended to rise slowly and steady yourself before standing up. Blurred vision. Some individuals may experience blurred vision while taking temazepam. This side effect can affect your ability to perform tasks that require clear vision, such as driving or operating machinery. If you experience blurred vision, it is best to avoid activities that may put yourself or others at risk. Memory problems. Temazepam can cause memory problems, including difficulty remembering events that occurred while under the influence of the medication. It is important to discuss any concerns about memory impairment with your healthcare provider. Coordination difficulties. Some individuals may experience coordination difficulties while taking temazepam. This can manifest as clumsiness or unsteadiness, increasing the risk of falls or accidents. If you notice any coordination problems, it is advisable to exercise caution when engaging in activities that require physical coordination. Gastrointestinal issues. Temazepam may cause gastrointestinal side effects such as nausea, vomiting, or stomach discomfort. If these symptoms persist or worsen, it is recommended to consult your healthcare provider. It is important to note that the severity and frequency of these side effects can vary from person to person. While some individuals may experience mild side effects that subside over time, others may experience more severe or persistent symptoms. If you are concerned about any side effects you are experiencing while taking temazepam, it is essential to consult your healthcare provider for guidance. Rare but serious side effects of temazepam. While rare, there are some serious side effects associated with temazepam that require immediate medical attention. These include allergic reactions. Some individuals may experience an allergic reaction to temazepam, characterized by symptoms such as hives, itching, swelling of the face, lips, or tongue, and difficulty breathing. If you experience any of these symptoms, seek emergency medical attention immediately. Mood changes. Temazepam can potentially cause mood changes, including feelings of aggression, agitation, or depression. If you notice any drastic changes in your mood while taking temazepam, it is important to consult your healthcare provider. Respiratory issues. In rare cases, temazepam may cause respiratory depression, which is characterized by slow or shallow breathing. If you experience difficulty breathing or notice any changes in your breathing pattern while taking temazepam, seek immediate medical attention. Sleepwalking or sleep-related behaviors. Some individuals may experience sleepwalking or other sleep-related behaviors while under the influence of temazepam. These behaviors can be potentially dangerous, and it is important to discuss any concerns with your healthcare provider. Paradoxical reactions. Although uncommon, temazepam can cause paradoxical reactions, where individuals experience increased agitation, restlessness, or excitability instead of sedation. If you notice any unusual or unexpected reactions while taking temazepam, consult your healthcare provider. While these serious side effects are rare, it is important to be aware of their existence and seek medical help immediately if any of these symptoms occur. How to minimize side effects of temazepam. To minimize the potential side effects of temazepam, it is important to follow these precautions. Take as prescribed. Always take temazepam exactly as prescribed by your healthcare provider. Do not increase the dosage or take it for longer than recommended, as this can increase the risk of side effects. Avoid alcohol. Alcohol can enhance the sedative effects of temazepam and increase the likelihood of experiencing side effects. It is best to avoid alcohol while taking this medication. Be cautious with other sedatives. Temazepam should not be taken with other sedatives or medications that can cause drowsiness, as this can increase the risk of side effects. It is important to inform your healthcare provider about any other medications or supplements you are taking. Gradual discontinuation. If you have been taking temazepam for a prolonged period, it is important to gradually reduce the dosage under the guidance of your healthcare provider to minimize the risk of withdrawal symptoms. Avoid abrupt stopping. Do not stop taking temazepam abruptly without consulting your healthcare provider, as this can lead to withdrawal symptoms. If you wish to discontinue the medication, work with your healthcare provider to develop a tapering schedule. By following these precautions, you can help minimize the potential side effects of temazepam and ensure a safer and more effective use of the medication. Interactions with other medications. It is important to be aware of potential interactions between temazepam and other medications. Certain medications can increase the risk of side effects or reduce the effectiveness of temazepam. It is critical to inform your healthcare provider about all the medications, supplements, or herbal products you are taking to avoid any adverse interactions. Some common medications that may interact with temazepam include antidepressants. Some antidepressant medications can enhance the sedative effects of temazepam, increasing the risk of side effects. It is important to discuss the use of temazepam with your healthcare provider if you are taking antidepressants. Antipsychotics. Certain antipsychotic medications can interact with temazepam and increase the risk of sedation and other side effects. It is important to inform your healthcare provider if you are taking antipsychotic medications. Pain medications. Opioid pain medications can enhance the sedative effects of temazepam, increasing the risk of side effects. It is important to discuss the use of temazepam with your healthcare provider if you are taking opioids for pain management. Antihistamines. Over-the-counter antihistamines, commonly used for allergies or cold symptoms, can enhance the sedative effects of temazepam. It is important to use caution when combining these medications and consult your healthcare provider for guidance. Muscle relaxants. Muscle relaxant medications can increase the sedative effects of temazepam, leading to an increased risk of side effects. It is important to discuss the use of temazepam with your healthcare provider if you are taking muscle relaxants. It is crucial to consult your healthcare provider or pharmacist for a comprehensive review of potential drug interactions before starting temazepam or any new medication. Precautions and warnings for using temazepam. Before starting temazepam, it is important to consider the following precautions and warnings. Allergies. If you have a known allergy to temazepam or other benzodiazepines, it is important to inform your healthcare provider. Allergic reactions can be severe and require immediate medical attention. Pregnancy and breastfeeding. Temazepam should be used with caution during pregnancy and breastfeeding. It is important to discuss the potential risks and benefits with your healthcare provider before using this medication. Respiratory issues. If you have a history of respiratory problems, such as asthma or chronic obstructive pulmonary disease, COPD, temazepam should be used with caution. This medication can potentially worsen respiratory issues and should be monitored closely. Liver or kidney problems. Individuals with liver or kidney problems may require a lower dosage of temazepam. It is important to inform your healthcare provider about any pre-existing liver or kidney conditions. Older adults. Older adults may be more sensitive to the effects of temazepam. A lower dosage may be recommended to minimize the risk of side effects. Close monitoring and regular follow-up with a healthcare provider are essential for older adults using temazepam. Always consult your healthcare provider for personalized advice and guidance based on your specific medical history and circumstances. Tips for improving sleep without medication. While temazepam can be effective in promoting sleep, it is important to explore non-medication strategies for improving sleep quality. Here are some tips that can help improve sleep without relying solely on medication. Maintain a consistent sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends. A consistent sleep schedule can help regulate your body's internal clock and improve sleep quality. Create a relaxing bedtime routine. Establish a relaxing bedtime routine to signal your body that it is time to wind down and prepare for sleep. This may include activities such as reading, taking a warm bath, or practicing relaxation techniques. Create a sleep-friendly environment. Ensure your sleep environment is conducive to sleep. Keep the room cool, dark, and quiet. Consider using earplugs, eye masks, or white noise machines to block out any distractions. Limit exposure to electronics. The blue light emitted by electronic devices can interfere with your body's natural sleep-wake cycle. Avoid using electronic devices, such as smartphones or tablets, for at least an hour before bedtime. Avoid stimulants. Limit your consumption of caffeine, nicotine, and alcohol, especially in the evening. These substances can interfere with sleep quality and make it difficult to fall asleep or stay asleep. Engage in regular physical activity. Regular exercise can promote better sleep. Aim for at least 30 minutes of moderate intensity exercise most days of the week, but avoid exercising too close to bedtime, as it can be stimulating. Manage stress. Stress and anxiety can interfere with sleep. Practice stress management techniques, such as deep breathing, meditation, or journaling, to help relax your mind before bedtime. Remember, it is always important to consult your healthcare provider if you are experiencing persistent sleep difficulties or have concerns about your sleep quality. Alternative sleep aids to consider. If you are seeking alternative sleep aids to temazepam, there are several options worth exploring. These alternatives may include cognitive behavioral therapy for insomnia, CBTI. CBTI is a type of therapy that focuses on identifying and changing the thoughts and behaviors that contribute to sleep difficulties. It has been shown to be effective in treating insomnia and can be a viable alternative to medication. Melatonin supplements. Melatonin is a hormone that regulates the sleep-wake cycle. Melatonin supplements are available over the counter and can help promote sleep. It is important to consult your healthcare provider before starting melatonin supplements, especially if you have any underlying medical conditions or take other medications. Herbal remedies. Certain herbal remedies, such as valerian root or chamomile, have been traditionally used to promote sleep. However, it is important to note that herbal remedies may not have the same level of scientific evidence supporting their effectiveness as prescription medications or CBTI relaxation techniques. Relaxation techniques, such as progressive muscle relaxation or guided imagery, can help calm the mind and promote sleep. These techniques can be learned through books, online resources, or with the guidance of a healthcare provider. It is important to consult your healthcare provider before starting any alternative sleep aids to ensure they are safe and appropriate for your individual needs. When to seek medical help for side effects. While some side effects of temazepam may be expected and manageable, others may require immediate medical attention. It is important to seek medical help if you experience any of the following. Allergic reactions. If you experience symptoms of an allergic reaction, such as hives, rash, swelling, or difficulty breathing, seek emergency medical attention immediately. Severe drowsiness or confusion. If you experience severe drowsiness or confusion that interferes with your daily activities or persists for an extended period, consult your healthcare provider. Worsening mood or depression. If you experience worsening mood, thoughts of self-harm, or depression while taking temazepam, it is important to seek medical help immediately. Respiratory issues. If you experience difficulty breathing, shortness of breath, or changes in your breathing pattern, seek immediate medical attention. Unusual or severe side effects. If you experience any unusual or severe side effects that are not listed here, consult your healthcare provider for guidance. It is always better to seek medical help if you are unsure or concerned about any side effect you are experiencing while taking temazepam.